Hey guys, and welcome back to Lil U Life. I'm Dr. Gibson Gray, and today we've got an eye-opening discussion about ROP. What is it and why is it important? I'll go over the what, why, and when of ROP and help to explain this possible complication that many premature babies may face. ROP stands for Retinopathy of Prematurity. It is a condition that affects about 2 to 3% of premature babies as a result of the oxygen that we have to give them to keep their blood oxygen levels normal. So this presents a little bit of a problem, because if we give too little amount of oxygen, we risk damaging their brain. But too much oxygen can risk damaging their eyes. So what do we do? And why does this oxygen damage their eyes? Well, like the rest of their body, their eyes are not yet fully developed. The retina is the thin layer in the back of the eye that senses light and allows us to see. It continues to mature all the way up until about 9 months of age. So much of the NICU journey, this part of their body is still growing. So as this part of the eye is forming, it is very sensitive to oxygen levels in the blood. So any excess oxygen floating around can cause the blood vessels that are still growing in the retina to grow too fast, which can lead to damage. So is this okay? But we've decided as a community in the NICU that this is an acceptable risk in order to protect the brain. However, we want to do what we can to protect both the brain and the eye, so there is a growing body of evidence and research that shows us how to lower the risk of ROP. We actually try to keep the baby's blood oxygen levels in a safe range that's not too high and not too low to minimize the damage to both the brain and the eyes. So what are those levels? Well, that's kind of a floating number as time goes on and more literature comes out. So we'll defer that question for now. However, in severe cases, we do know that ROP can cause blindness, so that's why we want to prevent this. Thankfully, this is rare now due to the treatment options that they have available. So preemies that are at risk for ROP will have an eye exam when they're a few weeks old. This is either done by an eye doctor in person, called an ophthalmologist, or by a nurse that uses a special camera that an ophthalmologist can see remotely with telehealth. So if the ophthalmologist feels that treatment is needed, then there's several options to slow the growth of these vessels in the eye, such as laser treatment or eye injections. So that wraps up our overview of ROP. I hope this has helped. Thanks for joining me today, and hopefully this information helps you to get a better understanding of your baby's challenges and complications that may arise while they're in the NICU. Thanks so much, and join us again next time while we learn about all things NICU.